Good evening, doctors. Welcome again. Today we are going to discuss about HIV/AIDS MCQs. What clinical condition listed below associated with what AIDS indicated category histoplasmosis? That is clinically category C. Okay. What clinical condition listed below is associated with what AIDS indicated category hairy leukoplakia? That is category B. What clinical condition listed below is associated with what AIDS indicated category Kaposi sarcoma? That is Kaposi sarcoma clinical category C. What clinical condition listed below is associated with what AIDS indicated category acute primary HIV infection? That is primary is for category A. Now, what clinical condition listed below is associated with what AIDS indicated category pneumocystis carinii is category C, clinical category C. What clinical condition listed below is associated with what AIDS indicated category bacillary angiomatosis is category B, B for bacillary, B for category. What clinical condition listed below is associated with what AIDS indicated category persistent generalized lymphadenopathy? That is clinical category C. A, sorry. This is clinical category. What clinical condition listed below is associated with what AIDS indicated category extrapulmonary cryptococcus C and C for clinical category C. Classify the following antiretroviral agent is by abacavir. Abacavir is a nucleoside analog reverse transcriptase inhibitor. So why it is not an NRTI protease inhibitor? Protease inhibitor include navir last. So here no navir. And nucleotides it includes vir in middle, the nucleoside. So now classify the following antiretroviral agent by its action epivir, that is nucleoside analog reverse transcriptase inhibitor. Yeah. Classify the following drug agent by its action indinavir. Navir includes protease inhibitor. Yeah. Classify the following antiretroviral agent by its action virane, that is nucleoside analog reverse transcriptase inhibitor. Yes. Non-nucleoside reverse transcriptase. This is non-nucleoside. Yeah. Classify the following antiretroviral agent by its action dilbardine vir in middle. This vir represent non-nucleoside reverse transcriptase inhibitor. Yeah. Classify the following antiretroviral agent by its action nevirapine vir between, that means NNRTI. Yeah. A patient with advanced aged has diarrhea, Wasner syndrome. An appropriate nursing diagnosis for this patient: diarrhea related opportunistic infection? No. Risk fluid volume deficit related diarrhea? No. Risk of infection related immunosuppression? No. Risk of impaired skin integrity related to altered nutritional status and nutritional status with frequent stool? This is the right answer. A patient with advanced AIDS has a nursing diagnosis of altered thought process related to the neurological changes in planning care. For the patient, the nurse sets the highest priority on maintaining a safe patient environment. This is answer. Now, effectiveness of antiretroviral therapy is measured by It is mainly measured by fall in plasma viral load and increase in CD4 count. No. Rise in red blood cell count and hemoglobin level. No. Rise in plasma HIV antibodies. No. Reduction in opportunistic infections. I think so. Yeah. Now, decision to benign antiretroviral therapy is based on CD4 plasma viral load, intensity of patient, clinical symptoms, all. So D is answer. Yeah. Which is the most important in case of patient diagnosis as associated with AIDS? Those who is expressing death wishes. He is in depression. Treat the patient for depression and suicidal thoughts. Yeah. Oral candidiasis in AIDS is treated by fluconazole. Human papilloma virus in AIDS patient is manifested as HPV is genital warts, flat warts, skin warts, neoplasia of cervix, vagina, and penis. So hope it's clear. Is the most common HIV related neurological complication, that is toxoplasmosis. Which of the following statement is false about antiretroviral therapy? Is ART reduce hospitalization, ART cures AIDS, ART increase survival rate, ART reduce HIV transmission? Answer is it cannot cure for AIDS. No cure for AIDS nowadays. Sorry. Goals of ART includes all except goals of ART: prolong of life and improvement quality, yes. Greatest possible reduction in viral load as long as possible, yes. Rotational sequencing of drug, limiting drug toxicity and facilitation adherence, yes. Elimination of HIV entirely from body, it's not possible, yeah. So this is answer. Which of the following listed drug is protease inhibitor? Protease inhibitor is Navir at last. Indi Navir. So this is answer, proteinase inhibitor. And these Veer in middle, it's an NRTI. Okay, and Gdovidine is NRTI. So Indi Navir answer. If I range Veer, it's an NRTI. This one is the answer. Which statement about initiating drug therapy ART in stage 4 WHO is true? Is treat CD4 count is less than 200, consider the treatment if CD4 count less than 350 and initiate ART, treat irrespective of CD4 counts, do not treat till CD4 count is available. I hope this is answer. Yeah. Gdovidine dose for adults adolescents in ART is 300 milligrams. Which statement about ART regimen is true? ART must be given in a 3-drug combination. I think so. Let's see. Yeah. Should be avoided in AIDS patient receiving ART during first 2 months of rifampin ATT due to drug interaction with iodine. Drug interaction with nevirapine. Remember. Neviparine. ART drug which should be avoided in case of pregnancy, that is efavirenz. Now, antiretroviral treatment with nevirapine is generally avoided in hepatitis chronic CLD. Combination of drug which is not generally recommended is stavudine, lamivudine. This one is not NVP and rifampicin is not recommended. Severe hematological toxicity associated with zidodine. The toxicity syndrome associated with use of nevirapine is ART is Steven Johnson syndrome. Syndrome presenting as occurrence of worsening of clinical and laboratory parameters, infection despite a favorable outcome of CD4 count. That is immune reconstitution inflammation syndrome. Factors contributing to drug failure in ART are all. Region of consider ARV drug substitution include all except occurrence of headache and vomiting. When was HIV first recognized in US? In 1981. Around the time doctors Los Angeles, New York were reporting rare case of pneumonia, cancer, otherwise illness among a male patient who had sex with other men. These conditions were not normally found in people with healthy immune system. The several years before scientists developed a test for the virus. Now, which of these is a symptom of HIV infection? Symptom HIV by blood test to know sure if HIV infection symptoms. Always reliable. They can be mistakenly with other illness symptoms like rapid blood weight loss, chronic infection. Usually do not appear for years. And even if don't have any symptoms, you still infect other people. This is one important reason the early testing is so important. A person has AIDS when which of the following occurs? CD4 count is lower than 200 or opportunistic infection, HIV infection. CD4 count is lower than 200, opportunistic infection, AIDS when there is 200. Read by your own this information. HIV positive means either antibodies against HIV or virus particle themselves or present in the blood. HIV attacks a certain kind of cell in immune system. Which is it? It's white blood cell called T cells. Now, the risk of AIDS is tied to a behavior. Which of the following is a behavior can you put at the risk? That is, HIV is mostly in blood, semen, or vaginal fluid. HIV positive person can pass the virus through unprotected sex, oral, vaginal, or anal, and through a sharing needle or syringes. Women can pass the virus to their babies before birth. During birth, through breastfeeding, the risk of getting HIV from the blood transfusion is extremely low. Why the combination of medicines? Okay. Why the combination of medicines called cocktail used to treat HIV? So medicines are designed to attack the virus different stages at its life cycle. When correctly cocktail overwhelms any chance of developing resistance to medicines. What is the best way to protect yourself against HIV? Use latex condoms during sex intercourse. Currently no vaccine is available for HIV. Not having sex. Protect yourself by staying in a sexual relationship with just one person. Monogamous. Using latex condoms when you are doing have sex. Not having any unprotected sex. Drug users must not share needles and syringes. They should not expose themselves to blood and other products. Remember, the person can HIV positive, not have symptoms. Yourself tested to learn your status before you have sex with a new partner. Ask the person about his/her HIV status. Ask when the person was last tested. Birth control pills and spermicides do not protect you from the getting HIV. So guys, have a good day. Goodbye. That's all for today. I already finished about the HIV/AIDS MCQs. So I hope this will give you a lot of information and knowledge basic. So if you still not subscribe my channel, please subscribe it, and if you like this video, put like on it. Thank you, good day and goodbye.